We have an important message here that we are all keeping at the forefront of our minds, and we would like to share it with our helpers as well. So last week, our COO, Nathan Betteridge, and CEO, Simon Lockyer, met with the Federal Minister for Aged Care, and his key message to us was that it is critical that we keep people who work in the aged and disability care industries working so that we can continue to look after and care for our loved ones. So you as an individual and we as a team are an important part of this industry at a very important time. And we want to make sure that we are able to operate and serve the members we help and the helpers that we support as best we can. All right, so here's just a bit of an overview about what we'll be talking through today. So first on the agenda here is the coronavirus response team. We have assembled a team, as Simon said, to support the organisation through this situation. Number two there, so sharing of information. There's a lot of information being shared in the community and frequent updates at the moment. So we'll go through how we're managing this and how we're sharing the relevant information to members, helpers and our staff. Simon also mentioned our standing operating procedure, which will be a key element of this webinar. So this is the document that we have developed for our workers to guide their practices at this time. Number four, reporting and monitoring. So this is how we're tracking all of our COVID-related reports and concerns and how we're actioning them. Number five, the infection control eLearning module that's available to help us to educate them about safe hygiene practices. We'll go through that. Number six, personal protective equipment. So this is a very hot topic at the moment, and we'll go through the status of our supplies and also access for helpers at the moment. Number seven, the Helper Hub and the important role that this is playing at the moment in keeping helpers informed about what's happening. And lastly there, we will have a talk about the should knows and must do's, a great new feature in the app that we have that we're utilising for our COVID response to remind helpers about information updates that are coming out and any required actions that might be relevant to their visits. All right, so the coronavirus response team, we have a dedicated team that we have set up who is communicating daily, we're meeting regularly and closely monitoring all the updates and alerts from, as Simon said, the peak bodies and also the Department of Health. And we are ensuring that all the relevant information is being shared and actioned across the organisation. So the team consists of a few representatives from different departments. So myself, the Community Workforce Manager, Simon Lockyer, our CEO, Nathan Betteridge, our COO, William Garton, our Head of Quality and Programs, and Amos Sharon, our Community Nursing Team Lead. So important to note too, Amos and William are providing guidance from the clinical side of things as they both have a nursing background. All right, information sharing. So I'm sure you're aware and all experiencing that the public is being bombarded really with information and updates at the moment from all of the news outlets and social media as well. So we just want to highlight that all the information that you need to do your job safely will be provided by Five Good Friends. And I just want to talk you through this workflow here of how we're getting this information to you and where it's coming from. So the first step here really is the monitoring of all these updates and alerts that are coming out. So Amos has taken on this responsibility for monitoring these alerts. And he is then posting the relevant information daily to a dedicated communication channel that we have for the COVID response team and also our management team. So we are then taking this information and the managers are disseminating it and very quickly operationalising it to the relevant teams and taking the changes and to our processes and rolling them out as quickly as we can. And we are also, from this information, preparing relevant communications to our members, helpers, and Five Good Friends staff to make sure that they have the most up-to-date information. We are sharing this information across a number of channels, so I'm sure you've seen over the past few weeks lots of different ways in which we've communicated to you. So the Helper Hub is a big one, and we'll chat a little bit further about that in a moment, but we are posting all of our email communications that we're sending out to helpers on the Helper Hub, so you have a record of those there, and all of the latest updates. We have a dedicated COVID page on Notion, which is our internal sort of intranet and information sharing page that we use. And we've got a public link there which holds the standard operating procedure, which all of our helpers now have access to as well. On the website, we have a dedicated COVID update section. So this is where we're posting all of the updates for our members to have access to as well. And we're of course communicating regularly with them via email. But if any members that you are supporting have any concerns or questions, you can refer them to the website as well as their care team, of course. In terms of keeping the company and internal staff up to date, we do have an internal system Basecamp that we use. And we are posting company-wide announcements to everyone, and everyone has to acknowledge that they've read that information so that we know we're all across the latest updates. And finally, should knows and must do's, which you would have seen popping up in the app recently if you've had any visits in the past few weeks. And we'll go through this a little bit more shortly. All right, so the standard operating procedure. So everyone, all helpers should have received at least 2 email communications from us in the past week about our SOP, which we're referring to it as. And this document, or the purpose of this document, is to provide guidance for all our helpers on how to safely deliver services to people during the current coronavirus outbreak. And this document is being regularly reviewed and updated in line with all of the ongoing alerts and communications coming from the Department of Health. I think we're up to our 2nd version now. And how can you access this document? So the link to the SOP is posted on the Helper Hub, and it always has the most up-to-date version. So you can download a copy and print it out, but we would also always encourage you to go to the Helper Hub and click on that link for the most up-to-date version. So we're really urging all helpers, it's essential that you read this document so that you're familiar with the different scenarios that you might encounter and how to handle these to protect yourself and members. If you have any questions at all, please call your helper coordinator and they can go through it with you. So just down the bottom of that slide there, there's also the link to the Helper Hub. You do have access to this on our website and also the link in the app as well. So anytime you need that information, it is there for you. Okay, so the SOP outlines various scenarios that you might encounter with members and the actions that you need to take and precautions you need to take. Do depend on whether the member's showing symptoms, if they're in isolation or quarantine, and also the setting that they might be in. So precautions may vary depending on whether they're in a village, a residential care facility, or in their own home. So we'll run through these scenarios for you that we've outlined. There's 3 of them in the SOP, and it's important just to note that in all scenarios, social distancing must be practiced where possible. So we do have an information sheet from the Department of Health, which is available in the resources section in the SOP in section 7, and also in the latest communications we've sent out, which are in your emails and also on the Helper Hub. And it gives a little bit more detailed information about what social distancing is and how you need to be practicing that. All right, so scenario 1, this situation is relevant to when you're visiting members who are not showing signs of COVID-19. And when we talk about signs in the SOP, that refers to a fever, cough, shortness of breath, and sore throat. So this scenario is really what most of our workers, our helpers are working through at the moment. 99% of our members are not showing signs of COVID, and really it is business as normal with a few additional precautions in place. So for these visits, if you're supporting a member who resides in a residential village or care facility and they're not showing any signs of COVID, it is still really important that you familiarise yourself with the procedures of the site that you're entering. So this might mean you might go and check in at reception when you arrive, and they might tell you about any or provide you with documentation, but any procedures that they have specific to their site at that time. And also just keep an eye out for any notices or that might be out notice boards, and particularly at the entry of these sites to alert you to any changes. In terms of personal protective equipment that you need to be wearing in this scenario, so you are not required to wear masks or PPE unless it's otherwise required. So of course, if you were providing personal care to a member, then in general you would be using gloves anyhow, but it is not necessary for you to be wearing a mask or other forms of PPE at this stage. The practice that you do need to be really aware of, though, is of course good hygiene practices. So this includes hand washing and cough etiquette. This is one of the best ways in which we can prevent the spread of COVID. So I encourage you to refer to our hand washing and cough etiquette fact sheets, which are in section 7 of the SOP. And so here we have scenario 2. So this refers to visits with members who are in a residential village or care facility, and that particular village or aged care facility is in quarantine or lockdown. So we are still able to undertake duties and provide support to these members who are living in a quarantine or lockdown situation, but there are of course guidelines that need to be followed. So I'll just run through a few of these. Number 1 there, visit times should be reduced where possible. So if, for instance, you might be providing support to a member who usually it's a 4-hour social support visit where you go and do shopping and go to the movies or go fishing, then we might need to be reducing those hours to, maybe a 1-hour visit where you pop in, you do the shopping, check that they're okay, and provide any medication pickups or anything essential that might need to be done. Again, you need to familiarise yourself with the procedures of the site that you're entering, very important. In terms of PPE, so again, if they're not showing signs of COVID, then you are not required to wear a mask, but you are required to wear other PPE. So this includes gloves, aprons, and use of proper hand hygiene and cough etiquette. If possible in this scenario, it's advised that we'd recommend the member to stay in another room or area while the helper is completing their required duties. This isn't always possible, but where it is, we strongly recommend it. So for instance, we had an example this week where a member's village was in lockdown and he needed some essential assistance with domestic tasks and laundry in his unit. And the helper went in with the required PPE, gloves, aprons, and of course practicing good hygiene and hand hygiene and cough etiquette. And the member actually was quite happy to sit outside on the veranda while she did the cleaning inside. And so we were able to safely provide that service and everyone was happy. If you are visiting a member that's in quarantine or lockdown and they're showing signs of COVID, then you need to refer to the guidelines in scenario 3. So this situation is where you might be visiting a member who is showing signs of COVID, they might have a confirmed diagnosis of COVID, or they've been directed to self-isolate. And this relates to all settings, whether it's at home, in a care facility or a village. So there are really important precautions that you need to take. Again, if they're in a village, you need to familiarise yourself with the procedures of the site, reduce the visit times where possible, and we will be restricting visits to essential services only, which will be determined by that member's care manager. So that might include medication support or essential showering and personal care services. but we will support you and direct you as to what is required. In terms of PPE, if you are in contact with a member who's showing signs or has a confirmed diagnosis or self-isolating, then both yourself and the member need to be wearing a surgical mask. So this is the scenario where the mask is required, given the current guidelines. It's also important that helpers wear an apron, gloves, and goggles. And again, where possible, please advise the member to stay in another room or area whilst you're completing the required duties. Okay, so in addition to the scenarios that we've just gone through there, the SOP also outlines general information on infection control and a few definitions about some of the terms that you'll be reading about. And we also have a section here, resources, which includes links to really an excellent range of resources that we strongly recommend that you familiarise yourself with. So this includes, like I said before, social distancing guidance, FAQs about COVID, and some of the fact sheets around practicing safe hand hygiene and cough etiquette, with the diagrams of how to do so. All right, so now moving on to reporting and monitoring. This is a really key part of how we are managing this outbreak, and the processes that we've put in place are there to keep helpers and members safe and well. So we continue to urge and strongly encourage reporting by anyone who meets the following criteria. And I have to say, we've had a really great response from our helpers who are being exceptionally cautious and reporting any concerns to us, because they are so concerned about their members and have them as their number one priority. And we really appreciate it, and continue to to encourage you to do that. So reporting is required by anyone who has recently returned from areas of high and moderate risk. So even if this person is well, in a recent update from the Department of Health, all countries are now considered to be a moderate risk. So all travellers entering the country must now isolate for 14 days. So I'm sure you would have heard about that in the news this week. In terms of reporting, also is required for anyone who has been in contact with someone who has a confirmed diagnosis of COVID-19, even if they are well. And also anyone who is showing signs of COVID infection. And again, those signs refer to cough, fever, shortness of breath, sore throat, and runny nose. And how we're monitoring all of these reports is that we have developed a register for people who have reported any of the signs of COVID infection or fall into the current identified risk categories. And we have a form to capture this information. So if you do call up with a concern, then the person taking that call will step you through a few questions so that we can collect the necessary information. The register is being monitored by the COVID response team, so we're aware of all reports and cases, and we're supporting the care teams to take any necessary actions. And a big part of this process is we're also making welfare check calls and ensuring we're kept up to date with the situation for each person affected or whoever might have reported it. So I would encourage you, if you, as a helper, if you are self-isolating or have reported that you're experiencing symptoms, and you might be off work for 2 weeks, we will continue to check in with you. So please, answer our calls and keep us posted on any updates as they come to light for you. Okay, so infection control and e-learning. All of our helpers have previously been enrolled in the infection control in a home care setting course, which is part of our standard online library of education modules, which is available to all of our helpers. So all helpers should have completed this course within the past 12 months, but if you haven't, then so you might be a new helper or you might have got partway through. If you haven't fully completed it, then you should have received an email reminder from us to complete it within the next 7 days. If you have previously completed in the last few months but you would like to do a refresher, then the instructions of how to do this are available on the Helper Hub. And we really encourage you to be up to scratch with this course and do a refresher, because infection control practices, hand hygiene, as we've been mentioning, sneeze and cough hygiene, it's one of the best ways that we can prevent the spread of coronavirus. So if you have any questions about how to access this, or you're unsure about some of the questions in there, there's a few tricky ones, please don't hesitate to email us and we'll provide that email shortly, or contact your helper coordinator. I should also mention that the infection control module, all of Five Good Friends staff are completing that as well. Now, personal protective equipment. So this is one area which I'm very aware is concerning for a lot of our helpers, as they've had issues in accessing supplies, and been talking to a lot of you over the past week, trying to give you updates. So hopefully you'll all be reassured by this update in the webinar. Just a reminder, so all helpers on the Five Good Friends platform are generally responsible as contractors for ensuring that you have these PPE items with you as equipment required to provide safe and high quality services to our members. We are continuing to do our best to secure personal protective equipment, as it has been reported that these items are in very high demand. We've got some really great news to share with you. We have a large order of PPE in place and on its way. So we have secured 15,000 masks on order, 500 bottles of hand sanitizer, and over 12,000 gloves. So that's just happened this week. And in terms of that arriving, so we have a bulk order due from 2 weeks' time, and that will be arriving in a staggered delivery. And we have interim supplies available for scenario 3 we went through there, where that full PPE is necessary. And this will arrive at the end of the week, and we have some emergency supplies available to support helpers in that situation in the interim. We have dispatched emergency kits of PPE to our community team. So that includes our nursing team and also our community leads. So that's Belinda Brandt in Queensland, Shane Sandy in New South Wales, and Jenny Davies in New South Wales, and also over to Karen in South Australia. So should you need any of these supplies, this will be relevant to situations where members are showing signs of COVID, or have a confirmed diagnosis, or have been directed to self-isolate, and also if they're residing in a residential village or care facility that's in quarantine or lockdown, then we have kits, emergency kits available for these high priority situations that our team have and can get out to you until more of these supplies arrive. Okay, the Helper Hub. So this, I just want to emphasise that really the Helper Hub is your source of truth at the moment for the most up-to-date information on COVID. So we are sending out the email updates to you. They're being posted on the Helper Hub, and this is also where we're storing that permanent link to our standard operating procedure for our ongoing home care services. So you can always refer to here to get the information that you need. And how do you access the Helper Hub? So you've got the website listed there below on the bottom of the slide. There's a link on our website, the Five Good Friends website, available, and the link is also in the app for you as well. All right, so finally, should knows and must do's. So this is a really amazing feature in the app that was recently rolled out, and we are utilising it in this situation to ensure that helpers are kept up to date. And you can see an example there. So anyone who's had a visit, in the last week would have received a should know on their sort of next visit, letting them know that we've recently sent you very important information, and prompting you to check that information and take the necessary actions. So we'll continue to post these in the app, these should knows, as we roll out more updates. You might also see on some visits must-dos that have been assigned to the visit. So we're using these, for anything that might be out of the ordinary for that visit, or might have changed given the status of that member's situation or the relevant scenario. For instance, if a member might need medication picked up that they usually would get themselves, but we might put a must-do in there for you to collect the medication on the way to the visit and have what's needed in there. We really want to emphasise how important it is for you to look ahead at your visits coming up for the day to see if there are any must-dos in there or should knows. It's really important, as always, that you check in on time so that you see that information before you enter the visit, because there might be really critical information there about a service the member needs, or how yourself and the member need to, what actions you need to take to keep you both safe. All right, so that's it from me. Again, thank you everyone for dialing in. I hope this information was useful to you and reassuring that we are very across the situation and doing everything that we can to support you. If you have any questions at all, please don't hesitate to contact your helper coordinator on our general hotline there, 07 3532 0796. We're available 24/7, so don't hesitate to call us. Or alternatively, as Simon mentioned earlier, please send an email to recruitment@fivegoodfriends.com.au, and we'll be collating any sort of common questions here and posting the answers out to helpers very soon. All right, well, thank you again, and stay safe and well, everyone.
Thank you very much, Sally, and thank you to everyone who attended. We are really grateful for your interest, and we, of course, are incredibly grateful for the kind and generous help and support you provide to our members. Please continue to look out for our updates, and we will continue to keep you up to date through other channels and information. Have a good rest of your day. Thank you.